Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there is one new case of COVID-19 to report. The total number of cases is 314. Today's case is a male in his 40s from Southern Health. The investigation is ongoing, but this is related to travel. This is a truck driver. As of this morning, no individuals are hospitalized and there is no one in ICU. 293 individuals are listed as recovered, and we have 14 active cases. On Friday, there were 3 cases identified. The case that was announced at 1 p.m. was a male in his 40s from the Winnipeg region. That is travel related, as a truck driver. 2 additional cases that were identified later in the day were a male and a female, both in their 50s from Southern Health, and those were both travel related and related to a known case. One of the Friday cases, as we announced on Friday, attended JT Store and Diner in Blumenort, June 10th at approximately 6 p.m. The individual was symptomatic at the time. Public Health is sharing this information to ensure people are aware and could seek testing if they were at this location and have symptoms. Again, likely a lower risk situation because, as we've been notified, that premise had social distancing measures in place, but we just wanted to ensure Manitobans were aware of the potential contact. On Saturday, there were 2 cases identified, a male in his 30s, which was travel related, this is a truck driver, and a female in her 20s. Both of those were from the Winnipeg region. The investigation on the female in her 20s is ongoing. I can note that this was a asymptomatic testing that had come back positive in that individual. An additional 1,951 lab tests were performed over the weekend, and this brings our total to 58,221. Manitobans are reminded to stay home when you're ill. Certainly seek testing when appropriate. The symptoms of COVID-19, fever, cough, sore throat, runny nose, aches, fatigue, headache, certainly present for testing, but it's imperative that Manitobans stay home when they're feeling ill. So as we've continued to remind Manitobans, COVID-19 is not going away. We've still seen this virus. And as we continue to reopen, we'll continue to see this virus. We need to learn to live with the virus because we know we need to deal with this virus in one shape or another for the foreseeable future. We're going to continue to ease our restrictions, and so we need to still be aware of this virus. Manitobans are well acquainted with the measures to reduce our risk of acquiring this virus. Frequent hand hygiene, practicing physical distancing whenever possible. And again, as we reopen things, it's going to be very vital that Manitobans stay home when they're ill. And this is not the typical for many of us. We've all battled through those colds. We've all gone out and done our necessary jobs or tasks when we've been feeling ill in the past, but to ensure success as we reopen things, we just can't accept that anymore. Manitobans, we need to stay home when we're ill. Manitobans can continue to access credible information at manitoba.ca/COVID-19, and there you can find the online screening tool. And so again, thanks to all Manitobans for your efforts, and I'll pass it over to Lanette.
Thank you very much. I'm Lanette Siragusa. Good afternoon. From Shared Health, the Chief Nursing Officer. So I would like to begin today with a belated recognition that yesterday was National Indigenous Peoples Day, and despite the presence of COVID-19 this year, it still remains a special celebration for us to acknowledge the unique heritage, the diverse cultures, and outstanding contributions of our First Nations, Inuit, and Métis people. They make great contributions to the communities, to our province, and to the country. Manitoba is also fortunate to have many wonderfully talented individuals who identify as Indigenous who work within the health care system. And that includes, but is not limited to, the dedicated professionals working in Indigenous health, which strives to develop representative workforce that is reflective of our population, identify, develop, and implement culturally safe environments, practices, and services, and as well support the holistic needs of First Nations, Métis, and Inuit people. We have also been very fortunate to work with various community groups and leaders during this pandemic, and their tireless efforts have helped to keep COVID-19 out of the First Nations, Métis, and Inuit communities. So I want to acknowledge and congratulate everyone for their work in flattening the curve over these past 3.5 months. And I hope everyone had a great celebration yesterday. We watched you on social media. The other thing I wanted to let you know, Minister Friesen earlier today identified that we would be changing our visitation protocols for the personal care homes. We recognize that family and loved ones play a very important role for our residents, both the health and well-being in their lives. And we're also really well aware of how the restrictions over the past several months, it's had an impact on residents and families. So nearly a month ago, care homes started scheduling outdoor visits, and while that process was underway, we also began work on how can we enable indoor visits. So there was a lot of work behind the scenes to make sure that we made this as safe as possible. In preparation, we have developed a refresher course in PPE education. We've reviewed the cleaning and disinfectant protocols. We've ensured that all PCHs have their outbreak protocols up to date and ready to go if need be. We've updated the screening questions so that they are aligned with the new public health orders. We continue to evaluate the one-site staffing model to minimize the travel of staff between multiple PCHs. And we've also had the opportunity to work with Manitoba Health, who is reestablishing the PCH licensing process, which was on hold as of March 12th, once we had our first outbreak, but it is starting up again, and we have been able to work with them to ensure that the COVID safety measures are part of this standards process. So we are very excited to tell you that the PCH visitor guidelines are now complete. We've had consultation with all the operators and the regions throughout the province, and indoor visits will begin starting tomorrow. And I do just want to be very clear that this is not a return to normal. Similar to the process we use for outdoor visits, care homes will be working with residents and families to identify a small number of loved ones who can come inside to visit. A plan must be developed in collaboration with residents and families to determine the nature, the duration, the frequency, the timing of the indoor visits by these designated visitors. And home care operators will be scheduling these visits either through a booking system or through designated drop-in time. I believe most of them will be making appointments. Visitors will be required to wear non-medical masks, face coverings at all times. They will be screened prior to entry and instructed to maintain social distancing at all times. The existing public health orders and infection prevention and control guidelines will continue to be followed, and visits may be suspended at any time without notice if there is an outbreak in the care home or in the community or upon the direction of the Chief Provincial Public Health Officer. So we do encourage people, this is a high-risk population, and we do want to find a balance between making sure that people can visit their loved ones and stay safe. So we're asking all Manitobans to continue supporting us in this. If you're not feeling well, do not go to the PCH. As much as possible, virtual visits and outdoor visits are a safer option, but now they're not the only options. So we'll continue to engage with government. We want to plan ahead. This includes, as Dr. Roussin and the minister have talked about, is alternative visiting space at the PCHs for maybe when the flu becomes more prevalent or the COVID activity increases. Having indoor visits may not be possible, but potentially there's another way through alternative spaces. So we're looking at everything we can do. We thank the residents and their loved ones for their patience until this point. We know it has not been easy, but we are grateful. And we also thank you for your patience over the coming days as the care homes will work to implement their plans. They'll be in contact with families soon. And lastly, I just want to give you some statistical updates. So in terms of healthcare workers in Manitoba, 272 healthcare workers were tested in the past week, and we have not had any positive cases of COVID-19 in nearly 6 weeks. So as you recall, we had a total so far of 26 healthcare workers who have tested positive for the virus. All have recovered and are back at work. As well are alternative isolation centers. So these are centers who, for those people who cannot safely self-isolate at home, or for vulnerable populations who are experiencing homelessness, who need a safe place to self-isolate. So there are, these spaces are also available to healthcare workers and other Manitobans who have or are suspected of having the virus and can't safely self-isolate at home. We can report that 17 people are currently staying in the hotel program, and this includes 9 people that were accepted into the program in the last week. The shelter program accepted 8 people into their program last week, and there are currently 13 people isolating at that site. And a quick scheduling update on the testing sites. So the Thunderbird House is closed today to mark the National Indigenous Peoples Day and will reopen tomorrow. The drive-through site in Selkirk will be closed on Sundays starting this coming weekend, and the site will continue to be open Monday through Saturday, 9 a.m. to 4 p.m. And in terms of patient traffic, Sundays have typically been the slowest day of the week in Selkirk, as they have been at most testing sites. So we do encourage all Manitobans experiencing any symptoms consistent with the virus to get tested. And for a full listing of the site locations and hours of operation, you can go to manitoba.ca/COVID-19. And that's it for me, and we'll open up the line to questions.
Thank you. Reminder to the reporters on the line, we will take one question and one follow-up. Starting today with the Brandon Sun, Drew.
Thank you. It's just to clarify something, but with the visits at municipal care homes, is it loved ones or caregivers who can visit actually inside the building now?
Yeah, so we haven't been super prescriptive because not everybody has family or, and some people, loved ones are like family. So what we've asked is the personal care homes to talk to the resident, talk to the contact people, the closest people. It's not really supposed to be for everybody in the community to come to the PCH. It's really, we're looking at people who are essential to the care of this resident. And we appreciate there may be more than one or two, and I think that's open for negotiation. It's more of a conversation. So it's not prescriptive on it has to be the next of kin necessarily. It's whoever is most valuable to that resident's caregiving.
Okay, thank you very much. And with regards to the new case that was announced today, do you know if that truck driver, did they come from Ontario, Saskatchewan, the U.S., where they came from?
Yeah, actually, this last test result was actually reported to us from Ontario. The testing took place in Ontario, so that was the nature of the travel.
From the Winnipeg Sun, Scott.
Hello, Scott Bill here, Winnipeg Sun. Question for Dr. Roussin. What, going back to, I guess, Friday's case of the person who was symptomatic, is there any penalties being levied against that person? And if so, or if not, why not?
Well, nothing has been ruled out. I think that we'll look at the specifics of it. Certainly, it appears that the self-isolation orders were not followed, and so certainly there could be penalties imposed. I think for the most part, our approach has been education, has been getting the message out to Manitobans, and I think most Manitobans are knowing that we're in this together, and that things like stigma and fear isn't what's going to get us through it. It's working together, and so in these cases, we much prefer to try to work with the individual, get cooperative contact investigation. We need further self-isolation because they're cases. So we find in public health we're much better able to protect the health of Manitobans through cooperation with people rather than living fines.
I guess my follow-up to that then is, what message does that send to folks then who are, if you're not penalizing the people that are, and it's very rare that we've heard about cases of symptomatic people out in the public, so if you're not going to penalize somebody who has done this, doesn't that set a bad precedent, I suppose?
I think it sends the message. What I just said is that Manitobans realize we're in this all together, and that most Manitobans, like you say, it's very rare to see cases like this. And then our best approach is not to have stigma or to have blame. It's to work together, try to find ways to encourage people to be considering themselves, considering their others. We have these orders in place because sometimes it's really our only resort to do that. But in situations where we can educate an individual, where we get them back into compliance, then it's usually a best public health approach to work that way.
From CBC Manitoba, Aiden.
Hi, Dr. Roussin. I'm wondering, you said that the couple that had traveled, or the pair of cases that had traveled that were announced Friday, were linked to travel and to the known case. So does that mean that they traveled somewhere and were in contact with a known case in that other location, or can you clarify that?
That's correct. Yes. So they're from where they travel back. So this was a travel back from U.S. and from Alberta, and they were a known contact to a case in Alberta.
Okay, thank you. And for the cases in truck drivers that were announced, can you say if any of these cases were detected through the asymptomatic testing that has been offered to truck drivers? And was there anything that links them in terms of where they may have been, where their routes may have taken them, for example?
Yeah, I don't believe that any of these cases were through asymptomatic surveillance. I think these cases had all had some symptoms, and again limited contacts.
From Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, if I'm doing my math right, I believe 3 of the 6 most recent cases are truck drivers. Aside from the offer of testing, are you considering any other measures, given that the case numbers now seem to be centered around truck driving.
Yeah, and so we knew that the highest risk to Manitobans was the importation of the virus. And so we've had a lot of messaging out on how to protect themselves, how to protect others. And even though we've seen these increasing cases, we're not seeing significant community contacts. And so any contacts are simply household for the vast majority of these. Getting tested appropriately, isolating appropriately, and also limited contacts with others. So we're going to continue that messaging, continue to work with the Trucking Association, and then, like you say, the asymptomatic testing is another opportunity for that. But I don't think we're going to be making any changes in that regard.
Okay, and we had several days a while back of zero new cases. The curve was as flat as a pancake, and now we're seeing a slight uptick in recent days. Are you concerned at all that this may point to people perhaps letting their guard down a little?
So we've been messaging right from the beginning that this virus isn't gone. We still see it circulating in all parts of the world. And so we knew the virus was still here in Manitoba, and we're going to continue to see it. And so that's why the messaging is we need to learn to live with this virus. And we can see that the majority of these cases are exactly as we see. They're imported. They're limited contacts that need to be isolated. And we're not seeing a lot of community-based transmission. But we need to still be alert. This virus isn't gone. And it's not likely to be gone in the near future. So we need to continue our progress with reopening the economy. But as we do so, we need to still be aware of this virus, and seeing increased cases alone isn't going to make us start backing away from our reopen plans. We have a number of indicators that we're following, but we need to get used to seeing cases. We just want to ensure that when we see them, these people are isolated, haven't had a number of contacts, and that we really limit the community-based transmission.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Govan from CCD Winnipeg. I'm wondering about the test positive rate with the cases in the last couple of days. Has that increased at all, and what is it at?
Yeah, so our test positivity rate for the last 5 days is 0.15%. And so Canada's as a whole is just under 4%. So our test positive rate is still quite low here.
And then also, we're seeing higher case counts in surrounding provinces. Saskatchewan had quite a jump yesterday. With the no self-isolation upon return now with the new phase, what are you looking at with the other provinces? Would there be a number that you would stop travel or bring back that self-isolation?
Yeah, and so we'll be looking at their test positivity rates, their evidence of community-based transmission. When we see a number of cases that are limited to a single cluster or to clusters, that's less concerning than if we're seeing a lot of community-based transmission. So we're going to watch that closely. But like we say, this is all a balance. There's never going to be a time when we're at zero risk in this near future. So we're going to see cases in other provinces. We can't really keep these restrictions on for a year. And that's how long at least we're going to be dealing with this virus. So we need to learn to live with it. And so people traveling to areas where there might be greater transmission from here need to be aware, and all of the things that we talk about every day here, hand hygiene, physical distancing, are all important when you're away. And when returning, people should be monitoring their symptoms, limiting their contact with others, the physical distancing. And so we need to learn to live with the virus, because it's not going away anytime soon.
From City TV, Stephanie.
Hello, Dr. Roussin. Just wondering, the asymptomatic test that was positive on Saturday, was this the first one that was tested through asymptomatic testing?
I think this is our first that was the routine asymptomatic surveillance. That's what I believe. This is our first test positive in that regard.
Okay, and what does that say to you, I guess, as a top public health official here in Manitoba, and what should that say to Manitobans?
Yeah, so I mean, I think that it's what we've been saying all the time is that asymptomatic testing is not a priority. We have a very, very low test positivity rate. I think we're probably close to 5,000 asymptomatic tests, and we have one positive. And so targeted asymptomatic testing is important. Say the truck drivers that we have set up, but certainly testing asymptomatic people should not be the focus of any testing strategy.
From the Winnipeg Free Press, Larry.
Yes, Dr. Roussin, Larry Kush at the Free Press. It's been a couple of weeks since the Black Lives Matter rally, and I've not heard of any cases related to that. What does that tell you about this event, and did we dodge a bullet, or is it just an indication that there's not a lot of virus in the community?
Well, I think there's a lot of things out there, and most of it is would be a bit of speculation. Certainly, we haven't identified a case that's related to that. We know outdoors is a much less likely transmission venue. We know that a lot of the protesters also were taking precautions. Many were wearing masks, hand hygiene. And so, yeah, so we know the transmission is much less likely outdoors. We still advise against large gatherings. But like you said, because we typically at that time had probably very low levels of this virus circulating, then that was an added safety feature to that. But we can see that the virus is not gone, and large group settings, outdoors or indoors, are opportunities for large transmission events to occur. So we still encourage Manitobans to stay within the recommended group sizes, to still practice that physical distancing whenever possible.
My follow-up is on the same issue. So how does that make you feel in terms of going forward with opening up, I guess, Manitoba to to sporting events or to to other sort of large crowds? What did you take from this? How did you feel about the result, and how does it inform your decisions going forward?
Yeah, so I think that one event, we can't use it to inform our plans going forward. We know we didn't have much of that virus circulating at that time, and so we can't really use just a single event like that to guide our policies going forward. But certainly we want to keep our numbers favorable. We know those outdoor venues are much safer, and so you can see from our phase 3 document, we're allowing for more groups to gather outside, still with precaution. And as time goes on, we may be able to further increase that. There are challenges, certainly when entering and exiting facilities. Even though there can be a lot of distancing within that facility, it can be challenging to not have crowding when people are entering or exiting. So these are all things that need to keep in mind. But I can't really say we'll be using that single event to guide our plans moving forward.
From Global, Brittany.
Good afternoon, Dr. Roussin and Siragusa. Wondering from both of you, after a number of months in this, how we're hearing now that we're going to start looking to build these temporary structures at care homes, your thoughts on these structures and why it is still needed moving forward 3 months into a pandemic.
So, yeah, so I mean, I think that as we are in this possible window here of low virus transmission within Manitoba, we've learned a lot about the virus. We've always known how important visitation is in all of our facilities, including PCHs, and so now with many restrictions, we're able to get back to some indoor visitation, but certainly not back to normal. But what we do know, it's a given that in fall we're going to be back in respiratory virus season, and that's going to be flu A, flu B, RSV, plus or minus COVID. And so it's very likely that we're going to need to restrict visiting again at that time. And so we're planning now ways of being able to address that without having to eliminate visitation, because we knew how difficult that was on families to be able to do that during these last couple months. So we're planning for the fall, expecting again the typical viral season. And so we need to put some plans in place now so we don't have to restrict so rigidly the visiting rules.
Yeah, and I would just also add, it's really trying to be proactive. We know every year that PCHs will have to go on outbreak protocols because of the flu. So we know that's going to happen. We anticipate this is going to be a short window of indoor visits, so we want to make the most of the low COVID numbers. But the other thing that we found in the last few months is that, Manitobans in general, but also businesses, they're so creative and they're willing to help. And this could be a really innovative way for us in our cold weather and getting ready for flu season, where we can make sure that our PCH residents still are able to connect with their loved ones. So it's a great opportunity and it's a proactive approach.
Further to that, my question would be, what kind of conversations have been happening with those care homes ahead of this for their input on what needs to happen when it comes to these kind of shelters?
Yeah, so we've had, through Manitoba Health, there's been some preliminary conversations with the PCH operators as well as the regional health authorities. Not every PCH is going to be able to have an outdoor shelter just because of the space that they have available to them. So we're looking at other options, but really making sure that the air circulation is good, the cleaning surfaces are easily able to wash them down and minimize the risk of spread and infection. So I think some people are not sure, some people are looking at the options, but I think everyone acknowledges that this is an effort to keep our residents safe from COVID. We've been really lucky in Manitoba, one of the few provinces that hasn't had a PCH outbreak. So anything we can do to negate that risk we want to do that.
From the Flin Flon Reminder, Cassidy.
Good afternoon. This is Cassidy from the Reminder. For Dr. Roussin, with those direct travelers to lodges and campgrounds, are those travelers allowed to go into towns to resupply?
Right. So from as the orders read right now, it is to be going directly to those camp sites, and it's to have limited contact with other urban centers. So that's how those orders are framed right now. Like any of these public health orders, we continually review them to see what is necessary at this time. And so with the travel orders, we're again looking at our relatively low numbers and maybe looking to further loosen those in the near future as well.
And I am hearing from some people who, I guess, think that this phase loosened up the general travel rules. Maybe can you reiterate why having these general travel rules are important?
Yeah, so I mean, it's just an example of the balance. So we see where the risk is. So the travel orders, the provincial travel orders, the 14-day isolation orders, were not restricting travel from areas that had higher incidence of the infection, but rather those people coming from there would have to self-isolate should they become cases where it's unlikely to have significant contact. So as the epidemiology changes in other jurisdictions, we can loosen or we might have to adjust back again depending on that epi. And then for the north, we knew that the remote isolated communities are very susceptible to severe outbreaks should an infection like this be introduced. So we added that layer of protection, the travel restrictions to the north, to try to limit that introduction. And over time, as we learn more about the virus, as we see our curve being relatively flat, then we will loosen those as we see.
We have time for a few more questions. I will throw this open now to the reporters on the line. With a reminder, please introduce yourself as you ask your question.
Hi, Aiden Geary from CBC News. My question is for Dr. Roussin. So just to clarify on the individuals announced Friday afternoon who had traveled and been in contact with a known case during that travel, so that you mentioned Alberta. So the known case that they were in contact with was in Alberta, or was it in the state?
It was in Alberta.
Stephanie Osuk with City News. Lanette, I'm just wondering if you can just talk to me a bit about what you hope that allowing visitors in personal care homes will do for the residents there in terms of their mental health, physical health.
Yeah, I think, health is bigger than just the physical health. It's the emotional ties and it's the mental stimulation. And I know the PCHs, the staff have been doing their very best to take the place of the visitors, and they care very well for those residents. But I think the ability to just be connected with your loved ones, it's just going to be, I think, an uplifting experience that has been long anticipated, and it's time for that to happen.
Hi, Michelle from CCV. I'm just wondering about today's case. If it was a truck driver and the testing was done in Ontario, did the driver then drive back to Manitoba, and what protocols is the person supposed to follow while driving back?
Yeah, so currently this individual is isolating in Ontario.
It's Larry Cushing of Free Press. I'm wondering if either of you could say how many PCHs are overdue for inspection and how many require upgrades to meet code.
So I can get back to you on that, Larry. I know that we were completely up to date by March 12th when we paused because of the COVID cases and decreasing visitors to the PCHs. I think we were all up to date. So I think it's just a matter of catching up from the last 2-3 months and getting back on track. In terms of, what was the second part of your question about being up to code?
Yeah, how many require upgrades to meet code?
I don't have the details on that, but maybe I'll ask if we can look into that and get back to you.
Scott Billick here from Winnipeg Sun. Do we know, or for Dr. Roussin, do we know how many people were exposed at the Blumenort diner/store?
No, and so that's why we announce those type of things. If we know the close contacts and we can follow up with all of them, then we typically don't announce the location because there's no other risks to the public. From what we know, that it's likely low risk. There was physical distancing taking place. There was a plexiglass between the workers and customers. So likely low risk, but certainly not zero risk. So that's why we announced that.
And have you found out any reason why this person went to the store while symptomatic?
No, I can't speak to any of that.
Thank you.
Okay, thank you. This concludes today's media briefing.
Thanks.
Thank you.